Welcome back, everybody. I'm your host, Stephanie Michele Sweigart. I am an SLP, a school-based SLP out of Los Angeles, California, here today with SpeechTherapyPD.com. We have a very important guest with us today, Dr. Noelle Johnson PhD, CCC-SLP. She is the Associate Director of the Arthur M. Blank Center for Stuttering Education and Research Satellite in Atlanta, Georgia, and this is through the University of Texas at Austin. She is also the chair of the board of directors of the National Black Association for Speech, Language, and Hearing. Dr. Johnson, you specialize in childhood stuttering. You present your research at local, national, and international scholarly conferences. You have first authored and co-authored many research publications, and you're a mentor, you're a volunteer. You've been recognized by professional associations and previous institutions for your contributions to the profession in teaching and scholarship and leadership. And we know that you are the proud alumna of the 2006 class of ASHA Minority Student Leadership Program. Did I miss anything? What are you getting into right now?
No, I actually just concluded my 3-year term on the ASHA Board of Directors and National Advisor to National NISLA. So I am currently now on the ASHA Board of Ethics. So very excited. To me, contributing to the profession and volunteer leadership is just dear to my heart. So I always welcome the opportunity. And thanks for having
me. Yes, absolutely. Thank you for taking time out of your busy schedule and blessing us with your presence and your wisdom. We know that you are the author on a course on SpeechTherapyPD.com called National Black Association for Speech, Language, Hearing, and You. And I'm very excited to be able to talk to you today about this course. I was listening to the podcast, and there are so many teaching strategies that you share. And I was having a memory as I was listening to this podcast with you and Michelle on First Bite. And I was remembering back a few years into my career, I was working at a school district, and there was an African-American teacher that sent 2 African-American students to the speech room for us to screen. And I remember I was screening for articulation, and the only sounds that I saw were the TH, the voiced and the voiceless TH substituted for the D and the F. And at that time, I hadn't had a lot of schooling or a lot of education in the area of cultural competence and looking at cultural differences and difference versus disorder years back when I was doing my undergrad and graduate school. So I had these really nice handouts I was super proud of and excited about as a new clinician. And I remember checking the boxes saying that, no further action was necessary, that this appears to be a difference and not a disorder. So my intention was really good. I wrote a note, I put it back in the teacher's mailbox. I actually included a page. These were like informational handouts that you could share with parents and team members. And I highlighted certain information to say that this was African American English. So my intention was good, but the impact did not land so. And the teacher was very upset, and there was tension, and I wasn't sure why. And moving forward, this wasn't really talked about. I didn't have a teachable moment in that moment. I just remember there being tension, and the teacher didn't understand my point of view. And I thought, well, this is a difference. I don't want to overqualify. It's not a disorder. Fast forward a few years later, I was in another district, and I had a student, a young girl, African American, that came in, again, screening for speech, same thing, articulation with the TH, wrote a note, checked off the boxes, and said, this is a difference, not a disorder. And I sent it home. One weekend, the director calls me. Mother was very upset. And again, we're looking at impact, the way it landed. My intentions were good, but it didn't land well. And mother had called the superintendent, was very upset. Superintendent called the director called me on the weekend. I'm like, what's going on? This seems serious. And I tried to explain to the director, well, this is the education I have. This is what the article says. When we're looking at students, we want to, appreciate and look at their culture and understand that, we're not going to label this as a disorder. And the one question she asked me, it took one question that changed everything for me that I wish I would have had years ago. She said, well, Stephanie, did you ask the parent about their culture? Did you ask if this is the language they speak in the home? Does mother use this type of language? Is the child exposed to others in the home speaking this language? And I froze. And I was like, no, I didn't think to do that. So that was a huge moment for me, a big error that happens. I was lacking in my cultural competence in learning more about the student's culture and speaking with the family and understanding their values and how they identify. And all that came rushing back for me when I was listening to your podcast. So I think there's so much wisdom in it for new grads, for CF, for all of us, for everybody who is in the field. And the golden question I really have for you today is, what are some ways that SLPs can ethically assess and treat a child with a suspected speech and language delay? If the child may have the African American English or not, or if we're not sure, what is the best way to approach this type of situation?
Well, that is a great question, and I'm going to get to an answer for you with that question. But I want to start out by saying you did what I would want you to do, in the sense that there was a substitution identified in a child who, where the substitution is historically common with African American English, and saying that this is not necessarily a disorder, it's a difference, and educating, because it's as if you were reading my notes, because one of the pieces that I have down as part of my answer is that advocacy and educating those around you, and making sure that, you know, people on the IEP team or the parent or teachers know the difference between a disorder and a difference, and understanding dialect. And so my answer is going to go in different ways, because as you were talking, things that came to my mind is just, and I think I may have mentioned this in that episode, the perception of dialects in our country. And those are some of the things that we need to do a better job at teaching our students about. So I always give the example in the States, if someone has a New York accent, and I will not embarrass myself and try to give my best New York or Boston accent. No, that's a dialect. You know, that is designated by sound production and vocabulary and things like that. No one really has a perception about one's ability if they speak a regional dialect from the East Coast, a Boston dialect or New York. But if you think about the perception or stereotypes that come to mind when we think of Southern dialect or Appalachian area and dialects, then comes to mind stereotypes and perceptions of less intelligent, less educated, even though that is a standalone dialect that shouldn't necessarily be linked to one's ability. African American English in our country, historically, we have looked at, and I say we as in the country, not me, but historically, there is this negative perception about African American English that some people have. Stereotypes of our ability based on how we talk, based on stereotypes of our education and being less educated and less intelligent. And that is so not the case. That is my dialect. And it's not slang, it's rule governed. But sometimes you can have people within the culture and outside of the culture that may agree or disagree with those perceptions. Mm-hmm. So you can run into a parent that may say, no, I don't want my child speaking AAE because of how society perceives them. Okay. I want my child speaking correct, although for the listeners, please know that there is no correct dialect. So you can run into that sometimes. And that's where that education piece comes in, of really making sure that it's clear that there is nothing wrong with speaking a dialect. There's nothing wrong about speaking AAE. I love it when children and adults know that you have a dialect. I speak 2 dialects. As I'm talking to you, I'm using my mainstream English, but I have the ability and the talent and the skill to code switch and use AAE when I need to. That's a skill set. That's something that should be people should be proud of and not be frowned upon. But sometimes, I mean, historically in the schools, there was a time where teachers would correct kids for speaking their dialect. So sometimes as speech language pathologists, we could be doing the right things and saying this is a difference. Ethically, it would be unethical to treat it because it's not a disorder. And you can face pushback of, no, I want this fixed, but there's nothing broken, you know?
Mhm.
So I would say
Powerful.
my answer so one, advocating and educating and saying this is the way the child speaks. There is nothing wrong with the way the child speaks. Just like a child can speak a different language, your child is speaking a different dialect. And what we can instead focus on is helping them understand that they are speaking a variation of English, which is really cool. How can we help them really grasp and understand that? So I'll say that. But then touching on the piece of your own knowledge. So ethically assessing a child for dialect means doing things that you alluded to, really digging deep into the interview process, asking the parents questions, listening to how the parent talks, because that can give you some idea of what the dialect is spoken in the home. Because it could be the case that the child doesn't speak AE, because the assumption is child is Black, child speaks AE. That's not always the case. I have family members that, do not speak AAE, even though they identify as Black. So we can't make the assumption
Right.
that everyone speaks the dialect based on their race. Because interestingly enough, I was in Baltimore City Public Schools and I had white students on my caseload, but because of the neighborhood they lived in and the school they went to, they spoke AAE. And what happened, Stephanie? They were on the caseload for having a disorder for the
Oh,
very same things, because the SLP before me they're not Black, so they can't be speaking AE. And I'm going, no, look at their environment.
the environment.
Everybody in their environment speaks it. So these kids need to be dismissed because they have a difference, not a disorder. So
So that's the regional dialect.
yes. So spending time really digging deep into what is a child exposed to at the home, in the school environment, in their neighborhood, what are their friends speaking, what are their family speaking, because then that gives you an idea of what I'm seeing with this child. Is it dialect or is it a disorder? And the last piece is just the assessment tools. We have got to do a better job of making sure that we are using assessment tools that are appropriate based on the child we are assessing and the cultural variations that they're bringing to the table. I know if there are any school-based SLPs listening, I know the schools will say you have to give these assessment tools, but there's a term dual scoring, where you score the test, standardized test, the way that it's supposed to be given, but then you also rescore it to account for those cultural differences. And in your report, you just say, here's the score based on the test, but after dual scoring based on their cultural dialect, AAE, the adjusted score is this. 3 of the 5 errors were culturally appropriate, those kind of things. So that's what I would say. That's my long.
So in the analysis, so you go back and you look at your protocol and you see the ones that were wrong, and then you analyze what those stimuli questions were. Yes. And then you take your education, your information, and then you speak on those. And yes. Then essentially rescore it. Yes. Pointing out that information.
Yes.
I wish I had all of this. I don't know what they're doing in graduate schools now. I mean, I've been in the field for a long time, but I just wish that I would have had more of this knowledge through the years, because this stuff
yeah, I feel like in the schools, in the graduate programs, they're doing a better job at making sure that students have this information going out. I think that piece about educating those around you is very important, especially for early career professionals, because I've been that budding SLP sitting in an IEP meeting with people who have been in the field longer than me. And you try to insert your thoughts, your opinion, your professional opinion. And sometimes that can be scary if people are questioning or questioning whether or not what you're saying is true. And so having the ability to be educated not educated, but being willing to educate those in your environment to stand true to this is my professional decision and this is why, and being able to share information with those around you so that they can then educate themselves.
I love that. I think, and in hearing everything you're talking about, I think where I was lacking was really diving into the point you said of who are their friends, look at the region that they live in, talk to their family members. That was the big piece that I was missing. So I could see where, regardless of if the family is identified or not with having African American English, I could see where it might have. I mean, I was making an assumption then if I didn't have all of those pieces and parts.
Now, there has been a time where you can tell a parent, this is dialect. Ethically, it's inappropriate for me to treat it as something that needs to be fixed. And the parent can still come back and say, but I still want it to be fixed. And so that to me is something that SLPs could face. And if I were in that situation, I would stand true to the fact that, I'm not recommending therapy, because therapy is for something that, typically needs to be remediated. Speaking a dialect is the same thing as speaking another language. And so instead, I can help you educate yourself and your child about the beauty of speaking two dialects and how to have the knowledge of when and where to use those, just like language. If I speak Spanish and I'm a child, then I need to learn that if the listener speaks Spanish, then I should use Spanish. If the listener speaks English and I'm bilingual, then switch to English. Spending more effort educating in those areas than to put the child in therapy, because that would be unethical.
I love that. Amazing wisdom. I hope that everybody that's listening is going to check out your course on speechtherapypd.com. We know that February is Black History Month. It's an opportunity to recognize and celebrate and learn about Black leaders, and it's a time to honor Black history, and Black history is American history. It's an opportunity for us to really move from as you mentioned, those biased or unfair stereotypes that can happen in society, and come to a place where we are really more mindful and aware of successful Black individuals, and we're honoring their achievements and their contributions. And the purpose of the month of February is to make all Americans aware of the struggle and the freedom for equal opportunity for everybody. So as speech clinicians in your strategies, we really have the opportunity, as you said in your course, to take the children that we're working with and put their best interests at the forefront of our focus. And we can begin to intentionally move away from maybe harmful practices. Even if we didn't know that we were being harmful, we might have had good intentions, but maybe the impact or what we were doing, it didn't line up. We can move away from that, and we can increase our awareness of race, of racial differences, of cultures. We can build our education and our cultural competence through taking courses like this one and others that are out there, and listening to the strategies that you've shared with us today. Thank you so much, Kia, for all of your wisdom and for all the work that you're doing right now in our field.
Thank you so much for having me. And I love how you said Black history is US history. And so looking at February as a time to renew our commitment to making sure that we, magnify voices underrepresented within the profession, within the field, the people we work with, the people we treat. And by the time this comes out, there should be 2 episodes there, and people can always visit embasla.org for more information about things that we do in this area.
That's wonderful. Do you have any other resources you want to share where people can find out about you or learn about your teachings or what you're a part of?
Yes, so of course, National Black Association for Speech, Language, and Hearing, the website embasla.org. We are actually celebrating our 45th convention. Oh, wow. Coming up in Washington, D.C. in April. And that's a great 3-day conference where you get concrete information on cultural and linguistic diversity as it relates to the profession. And then I'll also direct your listeners to, of course, ASHA's Office of Multicultural Affairs has some really good, newer, updated resources there. So for anyone, depending on where they are in their continuum, a cultural competence, all the way to cultural humility, being able to find information there. I'm always available on social media, on Instagram, LinkedIn, and Facebook.
Okay, wonderful. If you want to take a deeper dive into this topic, be sure to check out National Black Association for Speech, Language, Hearing, and You. Kia is going to describe the history of African American prevalence and growth within the world of speech pathology and audiology. She's going to describe considerations of how the SLP can work with students who are in early intervention to ethically assess and treat students with a suspected language delay or impairment that have African American vernacular English or reside with a family who speaks a dialect. She's also going to list 3 different ways in which you can become involved in groups like the one she talked about today, BASLA, and the Student Minority Leadership Program at ASHA, or in general, how you can just encourage diversity within our field at the local grassroots level. We do have an opportunity for you to take a free course if you are not a member at speechtherapypd.com. So please see below on how to access your free course. If you'd like to subscribe, you can get a 1-year subscription to speechtherapypd.com. You're going to have access to over 850 live and on-demand courses. You're going to be able to just search the topic that you're interested in. You're going to have courses pop up, podcasts, a variety to choose from. Select the one that works for you, an area that you want to grow your education. Go ahead, watch those, and we will report the CEUs on your behalf. We will see you back here next week. We are inviting more industry-leading experts to answer those golden questions that you are asking. If you like this episode, give it a thumbs up or be sure to subscribe to our channel below. We will see you here next week.